How does lung cancer recurrence affect your prognosis? When lung cancer comes back after treatment, it can significantly change the outlook for patients. The prognosis after recurrence is generally worse than at the initial diagnosis. However, the effect on prognosis varies based on several factors, including the type of lung cancer, when and where it recurs, and individual patient characteristics like age and overall health. For example, in non-small cell lung cancer, which is the most common type, about 20% of patients experience a recurrence after surgery. The average survival time after this recurrence is around 22 months, but this can differ greatly among individuals. Factors that can lead to shorter survival include being older than 65, being male, having a history of smoking, and the type of lung cancer cells involved. If the cancer comes back within 1 year of the initial treatment, this is a strong indicator of a poorer outcome. In contrast, small cell lung cancer, which is more aggressive and accounts for about 15% of lung cancers, has a much higher recurrence rate. About 70% of patients with small cell lung cancer will see their cancer return, often within 1 to 2 years after treatment. The prognosis after recurrence for these patients is generally not as favorable, with many surviving less than a year. The extent of the recurrence also plays a role. If the cancer is limited to one lung or nearby lymph nodes, the prognosis is better than if it has spread to both lungs or other organs. Lung cancer can recur in different ways, locally, regionally, or distantly. Distant recurrence, where the cancer spreads to other organs, usually indicates a more advanced stage of disease and is linked to a worse prognosis. Even after successful initial treatment, tiny cancer cells can remain as undetected and lead to a recurrence later on. Lifestyle choices, such as continuing to smoke, can also increase the risk of recurrence and negatively impact prognosis. When looking at survival statistics, it's important to remember that they depend on many variables, including the type of lung cancer, the stage at recurrence, and the treatment options available. For instance, localized small cell lung cancer has a 5-year survival rate of about 30% at first diagnosis, but this number drops significantly after a recurrence. In summary, lung cancer recurrence usually means a more challenging prognosis with reduced survival compared to the initial diagnosis. However, the outcomes can vary widely based on the type of cancer, how and when it recurs, and the patient's health. As medical advances continue, there are ongoing improvements in managing and treating recurrent lung cancer. It is crucial for patients to engage closely with their healthcare team to understand their unique situation and explore treatment options.